Welcome to the Victory Education Lounge. I'm your host Maurice, and today we're diving into part 83 of our series, focusing on obstructive sleep apnea and insulin resistance. Before we begin, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this crucial information. Obstructive sleep apnea, OSA, and insulin resistance. Two conditions that might seem unrelated at first glance, but research suggests a strong connection between them. Today, we'll explore this link, discuss management strategies, and look at prevention methods that could potentially improve both conditions. Have you ever wondered if there might be a connection between obstructive sleep apnea and insulin resistance? Well, it turns out there's more to this story than meets the eye. Let's delve into the realm of sleep and metabolic disorders, shedding some light on these two seemingly disparate conditions. Obstructive sleep apnea, or OSA, is a common sleep disorder that disrupts your night's rest. Imagine you're fast asleep, dreaming about your favorite vacation spot when suddenly your breathing pauses. This pause, often unnoticed, is a hallmark of OSA. It's caused by an obstruction in your airway, which can lead to a drop in oxygen levels and jolt you out of a deep sleep. The result? You wake up feeling tired and groggy even after a full night's rest. On the other side of the spectrum, we have insulin resistance. This is a metabolic disorder where your body's cells become less responsive to insulin, a hormone crucial for regulating blood sugar levels. When insulin resistance sets in, your body struggles to keep blood sugar levels in check, setting the stage for type 2 diabetes and other health complications. Now, you might be wondering, what does a sleep disorder have to do with a metabolic one? Here's where things get interesting. Research has shown a strong connection between OSA and insulin resistance. Evidence suggests that the repetitive drops in oxygen levels experienced by those with OSA can lead to a cascade of events that promote insulin resistance. Conversely, insulin resistance can exacerbate the symptoms and severity of OSA, creating a vicious cycle. But it's not all doom and gloom. Understanding this connection is the first step towards managing these conditions. By employing strategies such as weight loss, CPAP therapy, dietary changes, regular exercise, and more, it's possible to break this cycle and improve both conditions. Today we'll explore this link, discuss management strategies, and look at prevention methods that could potentially improve both conditions. So let's gear up and dive into the fascinating world of sleep and metabolic disorders. Let's dive into some solutions, management strategies, and prevention methods. First on the list is weight loss. You see, carrying excess weight, especially around the neck area, can contribute to both OSA and insulin resistance. Shedding these extra pounds can significantly improve both conditions. However, it's important to acknowledge that weight loss can be a challenging journey that requires long-term commitment. Next, we have CPAP therapy, which stands for continuous positive airway pressure. This involves using a device during sleep that keeps your airway open, effectively treating OSA. Studies have also suggested that it may improve insulin sensitivity. On the flip side, some people find the device uncomfortable or difficult to adjust to. Thirdly, consider dietary changes. Adopting a low-glycemic, anti-inflammatory diet can improve insulin sensitivity and aid in weight loss. However, this does require significant lifestyle changes and some forward thinking when it comes to meal planning. Our fourth strategy is regular exercise. Both aerobic and resistance training can improve insulin sensitivity, promote weight loss, and may even reduce the severity of OSA. But remember, this requires consistent effort and a substantial time commitment. Lastly, for this part, let's talk about sleep positioning. Training yourself to sleep on your side instead of your back can reduce the symptoms of OSA for some individuals. However, maintaining this position throughout the night might prove challenging for some. While these methods can be beneficial, they also have their challenges. It's crucial to find what works best for you. Stay tuned for the next part where we'll discuss more strategies and prevention methods. Continuing with our list of strategies and prevention methods. First up, we have alcohol and sedative avoidance. Limiting intake of substances that relax the throat muscles can reduce episodes of OSA and improve overall health. While this might affect some social situations or sleep habits, the benefits are definitely worth it. Next on our list is smoking cessation. Quitting tobacco use reduces inflammation and improves overall health, which can be beneficial for both OSA and insulin resistance. It's important to note that this can be a tough journey due to nicotine addiction, but remember the rewards are substantial. Moving on to oral appliances. These are dental devices designed to keep your airway open during sleep. They can be less intrusive than a CPAP machine for some patients, although they may cause jaw discomfort or changes in bite alignment. It's always a good idea to discuss this with your dentist or sleep specialist. Fourth, we recommend maintaining a regular sleep schedule. Consistent sleep and wake times improve overall sleep quality and may help with insulin sensitivity. We understand that this can be challenging, especially with varying work schedules or social commitments, but consistency is key when it comes to sleep. Finally, we come to stress management. Practicing relaxation techniques and stress reduction can improve sleep quality and insulin sensitivity. This might require learning new skills or making lifestyle changes, but the impact on your health could be significant. To sum it up, alcohol and sedative avoidance, smoking cessation, using oral appliances, maintaining a regular sleep schedule, and managing stress are all effective strategies for managing and preventing both OSA and insulin resistance. Remember, the goal is to manage and prevent both conditions, and these strategies can help you do that. Now let's look at some examples to illustrate these points. Consider Sarah, a 45-year-old woman who faced both obstructive sleep apnea and insulin resistance. Sarah decided to take control of her health. She started eating a low-glycemic, anti-inflammatory diet and incorporated both aerobic and resistance training into her routine. After a year of consistent effort, Sarah lost 30 pounds. The result? Not only did her OSA symptoms significantly improve, but her insulin sensitivity also increased. The story of Sarah shows us the power of weight loss, dietary changes, and regular exercise in managing these conditions. Next, let's talk about John. John is a 52-year-old man diagnosed with obstructive sleep apnea and struggling with unstable blood sugar levels. John decided to try continuous positive airway pressure or CPAP therapy. Every night he wore a mask that delivered a constant stream of air, keeping his airway open during sleep. Within a month of using the CPAP machine nightly, John noticed a significant change. His blood sugar levels stabilized and he reported feeling more rested and energetic during the day. John's example illustrates the effectiveness of CPAP therapy in managing both OSA and insulin resistance. Sarah and John are just two examples among many. Across the globe, people are successfully managing their obstructive sleep apnea and insulin resistance through various strategies. Some find success through weight loss, others through CPAP therapy, and still others through lifestyle changes such as dietary modifications, regular exercise, improved sleep hygiene, and stress management. Remember, there's no one-size-fits-all solution. What worked for Sarah might not work for John, and vice versa. It's about finding what works best for you and sticking with it. It's about making small, sustainable changes that lead to a healthier, happier life. As you can see, these strategies can lead to significant improvements in both conditions. Let's quickly recap the main points we covered today. We've delved into the intriguing link between obstructive sleep apnea and insulin resistance, two conditions that are more connected than one might initially think. We've also explored a plethora of management strategies and preventative methods, each with their own set of pros and cons. Weight loss was our first point of focus. Shedding excess pounds, particularly around the neck area, could potentially improve both OSA and insulin sensitivity. However, it requires a significant commitment and is often easier said than done. Next, we discussed continuous positive airway pressure or CPAP therapy, a highly effective treatment for OSA that could also improve insulin sensitivity. Yet, it's worth noting that some people may find the device uncomfortable or difficult to adjust to. We then delved into dietary changes, advocating for a low-glycemic, anti-inflammatory diet. This can improve insulin sensitivity and promote weight loss, but it does require significant lifestyle changes in meal planning. Regular exercise followed closely, with both aerobic and resistance training shown to improve insulin sensitivity, promote weight loss, and potentially reduce the severity of OSA. The challenge here lies in the consistent effort and time commitment required. We also touched upon sleep positioning, alcohol and sedative avoidance, smoking cessation, use of oral appliances, maintaining a regular sleep schedule, and stress management. Each of these strategies can potentially alleviate symptoms of both conditions, but they also come with their own set of challenges. Finally, we brought these strategies to life with real-world examples, demonstrating that with determination and the right approach, managing these conditions is indeed possible. Remember, managing obstructive sleep apnea and insulin resistance is a journey. Don't get discouraged if it takes time to find the strategies that work best for you. Stay persistent, and you'll see improvements. Before we conclude, I want to emphasize that the information in this video is for educational and entertainment purposes only. Any health-related decisions should be discussed with a licensed physician. Your healthcare team knows your individual situation best and can provide personalized advice. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts in the comments. Until next time, this is Maurice, wishing you health and vitality.